Hi, my name is Becca LaBounty. I am here to present my maternal newborn research. The article that I chose was called Improved Maternal and Infant Outcomes with Serial Self-Reported Early Prenatal Substance Use Screening. This research was done by Stacy L. Bowden, Cresta W. Jones, and Erwin T. Tabakunin. I know I butchered that. It was published in the Maternal and Child Health Journal earlier this year in 2021. Part of the reason why I chose this article or this topic of research was because of my clinical experiences at Chandler Regional in labor and delivery the last month. I had a patient that admitted to using drugs recreationally before she got pregnant. And she actually tested positive for THC when she got to the hospital. And so I got to see the process of testing her baby when her baby was born and seeing social services get involved in the heartache and stress that put everyone under. I had another patient who was actually considering adoption or abortion up until delivery, and she ended up keeping her baby once she held him, but she had said that she wasn't sure when the last time she used drugs were. And so she was tested, and that was a big ordeal also. And so it just sparked my interest into the issue of using drugs during pregnancy. And I feel like this is really relevant to our current society and the increase in drug use, especially opioid use. And how that affects maternal newborn patients. The problem, in 2014, over 30,000 babies were born with NAS or NOWS, and that's neonatal abstinence syndrome or neonatal opioid withdrawal symptom. And those numbers are continuing to go up. This is a big problem in our world today. In the most recent national study in 2017, women of childbearing years, 15 to 44 years old, admitted drug use at 30%. 30% of women in that age group admit to using drugs, and that makes them a lot more likely to use them during pregnancy, especially if they're addicted. Opioid use disorder, or OUD, among women of reproductive age is called a national pandemic right now. So I feel like this is very relevant to what our society is going through. Another problem is that most of the time women are only screened one time during pregnancy for drug use. They're only asked questions about drug use at their first prenatal visit, which is usually in the first trimester, but they're only asked one time during prenatal care. These researchers hypothesized that if they were asked multiple times throughout the pregnancy, that substance use would decrease by the end of the pregnancy. And they also wanted to see if the length of stay for infants at the hospital could be affected by continued drug screening throughout pregnancy. So part of the methodology that they used, the design was they made what was called the Bowden screening tool after Stacy L. Bowden, the researcher. It was a questionnaire that maternal patients would fill out at least 3 times during their pregnancy. Obstetric providers would use a positive screen to identify candidates for referral to community resources and drug treatment programs. So if a woman said, yes, I use drugs, or I have a family history of this, or I have used them, or I may use them in the future, then they would be referred to support services. Data collection, the screening tool again, was administered at the first prenatal visit and then subsequent visits until delivery. It identified tons of different drugs, everything you could think of here in this middle bullet down here in data collection. And then this was really simple. It was just a little questionnaire. When the women would get there for a prenatal visit, they'd hand her this form. She'd sit down and fill it out. Took a couple of minutes, and that was that. So here's a table from the research that shows some demographic information for these patients. Break it down by maternal age, race, marital status, income level, employment status, and then number of screenings before birth, and whether they ended up using a drug screening or not, a urine drug screen or not. Data analysis. So participants were divided into 3 groups, depending on when their first screening was done, whether it was in the first trimester, second trimester, or third trimester. And that just varied depending on when women came in for their first visit for prenatal care, or when they, and then they would administer the tool specifically to first, second, and third trimester patients to get a good view of the differences in substance use by the end of pregnancy. Then a McNamara test was performed, and electronic medical records were used to collect the following information: demographics, urine drug screen results, tobacco and alcohol use, whether there's family history of substance abuse, and then the number of prenatal substance use screenings throughout the pregnancy. And then infant data was collected depending on their gestational age at delivery, whether or not they were diagnosed with NOWS, and whether they needed morphine treatment after birth because of NOWS, and their length of stay at the hospital, and results from urine and meconium drug screenings if those were needed. So results: 251 women identified with substance use on their first prenatal screen. No matter when it was throughout their pregnancy, 251 women identified as using drugs. Women whose early prenatal screening occurred in their first trimester showed a decrease of 72% of substance use by the end of the pregnancy. So women who were screened at the beginning of their pregnancy, 72% of them were able to stop by the end of pregnancy. For those whose initial screening was in their second trimester, 44% of them were able to stop by the end of their pregnancy. And this gives information as far as marijuana, opiates, and other things, but I'm just focusing on overall substance use. And then if the initial screening happened in the third trimester, the decrease was much less. It was only 6% by the end of pregnancy. And here's a little bar graph to show you those decreases. I like bar graphs. So this red bar here shows any substance use. So if the first screening was done in the first trimester, substance use of any kind decreased all the way here. And if the first screening happened in the second trimester, decrease here, and third trimester, not much decrease here. Maternal outcomes. Here's a table that just shows basically the same thing as far as maternal outcomes, with referencing the end of pregnancy. And here's a table that shows infant outcomes. This shows whether they had NOWS, whether they needed treatment with morphine, and hospital length of stay as well. So some study limitations. This screening tool being administered throughout pregnancy really requires willing and honest self-reporting from patients. There has been research that shows that women are afraid that they'll lose custody of their children if they are honest about their drug use. More than 50% of children with children of women who have opioid use disorder don't live with their biological parents by the time they're 5 years old. The Bowden screening tool has also not yet been validated in a more diverse population. This research was done in a town in Wisconsin, so we'd like to see the same research done in other areas in the country. And this screening tool also assumes sobriety from the patients who are answering the questions. You are asking drug users to answer honestly about their drug use, and you're asking for sober answers from people who are not sober. So that might also affect the reporting that we receive in test screenings like this. So some implications for nursing practice. Why is this research, or why should this research knowledge be implemented? Well, we've got high and very, very much increasing numbers of NASA nows in our country. This tool proved to decrease reported substance use during pregnancy, and it proved to improve perinatal outcomes. Substance use during pregnancy also creates longer lengths of stay for infants, which, when you think about it, a lot of these patients who are using drugs tend to be on Medicaid. And so when their newborn has to stay at the hospital even longer, that means extra costs for Medicaid, which is something that everyone's paying for. And so this could greatly improve healthcare and the costs for healthcare, not to mention patients and the stress and heartache that patients go through when this is an issue. How could this research knowledge be implemented into nursing practice? Well, if we were to develop a universal tool, this research used the Bowden screening tool, but if we had a universal one that all maternal patients used and were screened throughout their pregnancy, nurses could be there to help support these women and help them find support and care for them as they might be scared of losing their children or whatever they might need. Nurses would be able to be there and have the knowledge that they'd need to support those patients the way they need it. And if we could store that data in a database so that nurses were able to see that information, see their screenings throughout their pregnancies, so that when they came into the hospital to have their baby, nurses would be better equipped to care for those patients because they would have more information. Recommendations for future research. This research study referred patients to community resources. If they screened positive for substance use, they would help them find community resources. So I feel like some research that looked into what resources were most effective, whether it's therapists, social workers, support groups, their obstetricians, maybe even foster parents speaking with these patients and letting them know, maybe not to scare them, but letting them know what life could be like for them and their babies in the future if the substance use didn't get under control. And then maybe researching the option of urine drug testing throughout pregnancy instead of self-reporting. This may be very hard to come by, especially when dealing with substance using patients, but it would be interesting to see if that was possible to make happen with urine drug screenings throughout the pregnancies also. And here are my references. And I really feel like this research was really informative and could give us some great insight into areas that we could improve in maternal newborn nursing. Thanks.